Okay, so welcome to session 2, tool assisted manual therapy for climbers, how to improve your climbing without actually climbing. Let's touch on some general technical issues, okay, that you need to be aware of, okay, when foam rolling. So the first thing is, what you've got to do, you've got to find a tender spot in the area that you're working on and keep the roller there on that spot. You need to wait for the discomfort to diminish by about 50 to 70%, okay. This could take some time, so you're going to have to hang in there, and it may also be uncomfortable. Okay, when this area is no longer sensitive, okay, then you can begin to see if there are other areas which are sensitive, and you just simply repeat the process again. So when the area is free of pain, okay, then you can just roll over it, and then you can continue rolling on a regular basis, okay, to keep that area nice and relaxed. So you can use rolling, okay, as a warm-up, okay, prior to activity, and also as a warm-down, okay, or cool down after activity. Okay, you have the freedom to experiment, okay, and to feel the tissues when using the roller. So what I would suggest is basically just work out what works best for you, okay, and you can manipulate the various variations with the lacrosse balls and the rollers until you find, okay, the correct position. Okay, and then that way you'll be able to create your own variations of exercises, okay, to address your own particular needs. So the first important muscle to treat is the latissimus dorsi. The latissimus dorsi is responsible for extension, abduction and internal rotation of the arm. In climbing terms, it's a very important muscle because it's the key pulling muscle when you're hiking yourself up and trying to get that red point. Now, why do we treat it? Well, essentially, much like the pecs, the lats can become short and stiff due to overtraining. Okay, this lack of extensibility can lead to overuse injuries and poor mechanics, okay, when lifting, and also it creates that characteristic horribly looking climber's posture with the head pointing forwards and the shoulders rounded. So what do? The setup. Start next to a wall, okay, you can have the arm outstretched or you can have it out down, okay. What you want to do, place the lacrosse ball just behind your armpit, in between the lats and the wall. Okay, slowly roll the ball into those tender points and down along the outside of the armpit. Okay, feel free to flex and extend the arm and also the knees to increase the range of motion. Okay, roll, okay, really until those symptoms reduce by about 50 to 70%. Okay, if you want to make it a bit harder, you can use a harder ball. Okay, so the next beastie to treat is Pectoralis Major. Pectoralis Major originates from the sternum, clavicle and also the costal cartilages and inserts into the humerus. The pec is responsible essentially for what we call horizontal adduction and internal rotation. Essentially, if you're a climber, what that causes, it causes that rounded posture once again, okay, and that forward head position. Why do we treat it? Pec major is typically, it becomes short and stiff, again due to overtraining and overactivity and poor chronic postures. So this lack of extensibility can lead to overuse injuries and poor mechanics during climbing. So how do you do it? Stand next to a wall and place the lacrosse ball on the wall and at chest height. Push your pecs into the wall and hold it in place until the symptoms have reduced. Guess what? By about 50 to 70%. Okay, if you want to make it harder, by all means choose. You can feel free to extend and flex the arm up and down, okay? Or failing that, just use a harder ball. Okay, so that draws us to a close, okay, for today's class. Okay, and on the next one we will cover other important muscles associated with the upper cross syndrome. Okay, bye for now.